mention is that Liberals at the Health Committee are currently filibustering any attempt to even study this program. They want a cover-up.
Mr. Speaker, that minister knows very well he has lost 32,000 people who have been ordered deported. We are talking about people who claim refugee status only after they are investigated or arrested for crimes like terrorism or extortion. We need to talk about such people because they are receiving better health benefits than ordinary tax-paying Canadians.
The health system is a compassionate system. So what we are saying is those people, they need to have access to health.
Canadians' needs. This isn't about the quality of health care that Canadians need. The only solution that they're putting forward is to deny the children of refugees dental care. Frankly, Mr. Speaker,
Member for Similkameen, South Okanagan, West Kootenay.
Thousands of people in BC can't see a family doctor. Yet the Liberals now provide deluxe health care benefits to rejected asylum claimants at taxpayers' expense. The PBO has shown that the interim federal health program has skyrocketed in costs to almost $1 billion. Will the Liberals support our motion and ensure that rejected asylum claimants do not get better health care than Canadians?
Thank you, Mr. Speaker. And look, I want to assure all Canadians that asylum seekers who come to this country are judged for their legitimacy. If they are found to be legitimate refugees and asylum seekers, like all compassionate countries, like all signatories to international agreements, they are permitted to stay. Those who are not found to have respected those criteria are asked to leave. This government has made very, very tough measures in this Bill C-12, currently before the Senate, to make sure that we can continue to get that number down.
The honourable member for Similkameen, South Okanagan, West Kootenay.
What the member did not mention is that Liberals at the Health Committee are currently filibustering any attempt to even study this program. That doesn't sound like they're trying to fix anything.
In the 2025 budget in terms of cost constraints, and particularly as it relates to the supplementary benefits and co-payments and so on. So this is clearly a very initial
They want a cover-up. Conservatives are clear on the solution. No more physio or vision care for rejected asylum claimants. Yeah. Will the Liberals support our motion and ensure that rejected asylum claimants do not get superior health care benefits to Canadians?
L'honorable ministre de la Santé.
Mr. Speaker, it's really unfortunate that we have this kind of conversation where we are talking of the health of Canadian and asylum seekers. The reality is those people are in the country and we have agreement. And our system, this health system is a compassionate system. So what we are saying is those people, they need to have access to health. And we are working closely with provinces and territories also to get more access to Canadian people. Thank you.
The honourable member for Red Deer.
Mr. Speaker, the Parliamentary Budget Officer reports the interim federal health program will cost nearly $1.5 billion a year to cover health care for fraudulent asylum claimants. This program gives anyone claiming asylum better health care than Canadians who pay for it, even if these claims are denied. As wait times grow and health care access shrinks for citizens, the Liberals prioritize a growing list of bogus refugees over Canadians. Will the government support our Conservative motion to stop criminal claimants from receiving superior health benefits at Canadian taxpayers' expense?
Well said. The Honourable Minister of Justice.
Mr. Speaker, I would put more credence in my honourable colleague's argument if he or his party actually had a record of defending better health care for Canadians. Think about the record that they have demonstrated over the time I've been a member of Parliament. They have opposed the largest transfer to provincial health care systems.
Wow.
They have opposed dental coverage for Canadians. They have opposed birth care and other essential medicines that Canadians need. This isn't about the quality of health care that Canadians need. The only solution that they're putting forward is to deny the children of refugees dental care. Frankly, Mr. Speaker, this is disgusting, un-Canadian, and beneath this House.
The honourable member for Niagara South.
Mr. Speaker, too many people in Niagara cannot find a family doctor. Right now, taxpayers are being charged up to 5 times the provincial rates to provide health care to rejected asylum claimants. Families have waited long enough, and our failed asylum system is making them wait even longer. Conservatives have proposed common-sense solutions to address this horrible situation. It's time for the government to remove benefits to bogus claimants. Will the government support our motion and ensure that non-citizens and non-permanent residents do not get superior health care to Canadians?
The Honourable Minister of Public Safety.
Mr. Speaker, you know what happened? Mr. Speaker, do you know what happens with failed asylum seekers? They're removed, Mr. Speaker. Last year, we removed over 22,000 individuals who are inadmissible, Mr. Speaker. We as a government are ensuring
32,000 missing. 32,000 missing.
The Honourable Member for...
It's okay.
Yeah.
So, I'm sorry. There are 32,000 people set for deportation that are on warrant, which means you don't know where they are. Am I clear?
Correct. We are looking for them. And I will point out, these, as I said, are points in time. And so since we last met, we have removed more of those people on warrant. And then, unfortunately, we have had people who have absconded. These are fluid.
I understand.
And
they're
500 CBSA officers doing excellent work
I don't
all of
doubt
the
that,
time
ma'am.
to remove these individuals.
Ma'am, with all due respect, we have 30,000 deportation orders. This is half of Kamloops we're talking about. That 32,000 people are lost. I'm just going to leave it there and give the time to MP Kirkland. I'm just befuddled at that number. Thank you.
On the top, please.
Mr. Speaker, you know what happens to failed asylum seekers, Mr. Speaker? They're removed. Last year, we removed over 22,000 inadmissible individuals from Canada. This year, through the Strengthening Canada's Immigration System Act, C-12, which is now going through the Senate, Mr. Speaker, we will be removing more individuals and more will be ineligible to seek asylum. We are hiring 1,000 new CBSA officers, the first cohort of which are graduating this Friday, Mr. Speaker. We are strengthening our border and ensuring that those who are inadmissible, we will be removing more individuals and more will be ineligible to seek asylum. We are hiring 1,000 new CBSA officers, the first cohort of which are graduating this Friday, Mr. Speaker. We are strengthening our border and ensuring that those who are inadmissible do not remain in here, Mr. Speaker. Thank you.
The Honourable Member for Kitchener South Hespeler.
Mr. Speaker, that minister knows very well he has lost 32,000 people who have been ordered deported. As a physician, as the son of a refugee to Canada, this issue is very close to my heart. I wish we were speaking about healthcare today, but instead we must speak about healthcare fraud. We are talking about people who claim refugee status only after they are investigated or arrested for crimes like terrorism or extortion. We need to talk about such people because they are receiving better health benefits than ordinary tax-paying Canadians. When seniors in Kitchener can't find family doctors and can't afford their medicines, how on earth does the Liberal government...
The Honourable Minister of Jobs and Families.
Mr. Speaker, I don't think that member was around when the opposition party voted time and again against the investments that provinces and territories have been asking us to make in strengthening our universal healthcare system. Mr. Speaker, that's how we build a healthcare system that everybody is proud of, something that we built on the foundations of our forefathers and mothers in this place, where we can ensure that people can access quality, affordable health care across this country, Mr. Speaker, not by tearing down different groups of people.